Ossification of the posterior longitudinal ligament, or OPLL, is a progressive spinal disorder where abnormal bone forms along the ligament at the back of the spine, most often in the neck. This can lead to narrowing of the spinal canal and compression of the spinal cord, resulting in symptoms like numbness, weakness, and difficulty walking. OPLL is more common in men and certain populations, such as those of East Asian descent, and often appears in middle age. Exact cause is complex, involving genetic, metabolic, and environmental factors. Genes like BMP4 and COL6A1 have been linked to the condition, and factors such as diabetes and high BMI can increase risk. Early stages involve changes at the cellular level with bone gradually replacing ligament tissue. Understanding these mechanisms is crucial for effective diagnosis and management, setting the stage for exploring treatment options. Diagnosing OPLL relies on advanced imaging techniques like CT and MRI, which help determine the extent of bone formation and spinal cord compression. The severity of symptoms and radiographic findings guide whether to pursue conservative or surgical management. Asymptomatic patients are usually monitored, while those with neurological symptoms such as myelopathy or radiculopathy may require surgery. Key factors in surgical decision-making include the canal-occupying ratio, cervical alignment, and the K-line, which help predict the best surgical approach. For example, if the OPLL mass crosses the K-line, an interior approach is often favored. Patient selection is critical, as the risks and benefits of each surgical technique vary based on individual anatomy and disease progression. This careful assessment ensures that each patient receives the most appropriate and effective treatment. Surgical management of OPLL is tailored to each patient with three main approaches: anterior, posterior, and combined. The anterior approach, such as cervical discectomy and fusion, allows direct decompression and correction of spinal alignment, but carries higher risks like cerebrospinal fluid leaks and swallowing difficulties. Posterior approaches, including laminectomy with or without fusion and laminoplasty, are preferred for multilevel disease and preserved cervical lordosis. Laminoplasty preserves motion but may allow disease progression, while laminectomy with fusion offers durable decompression and stability. Combined approaches are reserved for complex cases with severe deformity or high canal occupancy. Each technique has its own advantages and limitations, and the choice depends on factors like the number of affected levels, alignment, and patient-specific risks. Recent studies show that both anterior and posterior surgeries can significantly improve neurological function, but careful planning is essential for optimal outcomes. Future of OPLL management is being shaped by technological advancements such as robotics and augmented reality (AR). Robot-assisted surgery has shown high accuracy in placing spinal instrumentation, which is especially important in the delicate cervical region. AR systems can overlay digital anatomical information onto the surgeon's view, improving precision and potentially reducing complications. While these technologies promise safer and more efficient procedures, challenges remain, including high costs and the need for specialized training. Ongoing research is focused on establishing the long-term benefits and cost-effectiveness of these innovations. As these tools become more integrated into surgical practice, they may enable more personalized, minimally invasive, and even remote procedures, ultimately improving outcomes for patients with OPLL. The field continues to evolve with the goal of refining guidelines and expanding access to advanced care.